It's springtime. The weather is getting generally better. People are getting outdoors more, but that can be difficult if you have foot or ankle pain. With me now is Dr. Trevor Haynes with Elite Foot and Ankle Associates. Good morning.
Good morning.
Okay, so you treat everything below the knee,
Yep.
but foot problems are a much bigger deal for people with diabetes. Why is that?
Well, number one, diabetics heal a lot slower than your average person. And number two, a lot of them are neuropathic, meaning they don't feel their feet. So when they start to develop problems in their feet, they have no idea what's going on. They don't feel pain, they don't feel that sensation. So they'll keep walking, they'll keep doing everything as though nothing's wrong.
Wow, okay. So what causes diabetic foot wounds?
Just, again, pressure. It's mostly pressure being on your feet, that repetitive micro trauma that they're getting, whereas you and I, if we started to feel it, we'd get off our feet because it started hurting. Where it doesn't hurt them, they just keep going.
So I'm assuming it's important to have check-ins if you've got diabetes.
For sure.
Those feet
For
looked
sure.
at often.
Yep. We typically recommend, if you're not having any issues, at least once a year. If you've had issues, maybe an amputation, a previous wound, then as soon as every 6 months, if not sooner.
Okay. There's also something called fat pad loss. So explain what that is and how it comes into play here.
Yeah. So starting in your early 30s. Depending on what you do from a daily basis, whether you're on your feet all day, whatever, you start to lose some of the fat padding on the bottom of your feet. And when you do that, it starts creating more problems, such as pain, ball of foot pain, which we call metatarsalgia, heel pain, things like that from just being chronically overloaded. And in diabetics, they'll suffer some of the same thing, except for if they've had a previous ulcer, they're also going to lose some of that fat from that previous wound that doesn't come back. So these can be very problematic, not only in just your everyday person, but more so in diabetics.
But you can do fat pad restoration. So tell us about that and how it helps.
Yeah, so we can use that on anybody, but where it really comes into play at diabetics is, if they've had a chronic wound that won't heal, a lot of times those wounds are deep and they've affected the fat pad, like I said. So we can kind of go up underneath those and inject some fat or kind of a pillow to kind of give them a little bit more padding so that it'll help these wounds heal, because they now have a more protective shock absorber between the skin and the bones.
Sure, got it. Is anyone a good candidate for this type of treatment?
Yeah, anyone is. I mean, if you were an uncontrolled diabetic, we'd be a little bit more cautious. But yeah, anybody can be a candidate for this.
Do insoles or comfy shoes help? Anything like that?
For sure. As a diabetic, we always recommend people get what we call diabetic shoes and a diabetic insert. A lot of times insurance companies will cover that for them because it helps prevent wounds. So we'd want to couple maybe a fat pad injection with those to help extend out the life of that injection.
Yeah, I was going to ask, how this fits into overall diabetic care, but it sounds like you take a multi-pronged approach if someone with diabetes comes into your office.
Yeah, sometimes even surgery is needed, to help offload some of the pressure and then put the fat back underneath, so it's more than just injecting fat. A lot of times it might be surgery or the orthotics and shoes in combination.
Yeah. What else do you treat at Elite Foot and Ankle Associates?
Yeah, we treat trauma, we treat just your everyday foot pain. Definitely see a lot of plantar fasciitis. That comes in quite a bit. Neuromas, you name it. Anything in the foot and ankle, we'll take care of it.
Yeah. You've got 6 locations around town.
I do.
And so people can make an appointment at any one of those locations. Tell us more about how that would work.
Yeah, so they can just call our office at any of our locations. Are surrounded throughout Portland, in the Portland metro area. They can call us at 503-668-5210, or they can check out our website at elitefaor.com.
And when a person with diabetes comes into the office and you provide them with all these options, I'm sure they're just so grateful, feeling a lot of relief from that, right?
Yeah, it's good for them to know that there's options. Some of them have already maybe had amputations or have had other complications associated with it. So to be able to give them more of a treatment plan on how to avoid future amputations or problems, it's always a bit of a relief for them.
Yeah, and I understand wound care for folks with diabetes it takes them a little longer to heal, I think you mentioned?
Yes, it does. It takes them longer, and that's just diabetes. Especially if they're uncontrolled, that will take longer. But again, we're going back to the pressure and them not being able to stay off it because it doesn't hurt, so they just keep walking on it. That also will inhibit healing as well. Yeah,
well, yes, it's so important to have healthy feet and ankles. So again, tell people one more time your website and how they can make an appointment with you.
Yeah, elitefaor.com is our website, and they can call our central kind of number at 503-668-5210.
Awesome. Good work that you do. Thank you so much for coming, and I always learn something new when you're here.
Thank you. Appreciate it.
We'll be right back.